Hi, everyone. Thank you for joining Americans for Safe Access for this webinar today on our new State of the States report. It was just published today. We're very excited for this report to be out. It is a great comprehensive resource. We looked at all 50 states and 5 US territories, and we graded all of them on 120 metrics total. And at the end of that, we came up with a letter grade for each state, grading how well their medical cannabis laws serve and protect patients. Today, walking you through this report is me. I'm Abby Raudebush, the Director of Government Affairs with Americans for Safe Access, and we also have Andrew Kuhn, our Policy Coordinator. We've been hard at work on this report, and I know that we are very excited to share everything with you. To get started, I will turn it over to Andrew. We're just going to show you guys how you can access this report online at safeaccessnow.org.
Yeah, so you can click that picture of the report down there. It'll take you right to this landing page with the link to this very webinar right here. So you guys actually might have come here from there. Normally the report will load up right here, but maybe I've got a lot going on my internet right now. We've also got a whole lot of links and stuff down here. You can download your copy. We've got all your qualifying condition breakdowns, the score rubric. If you really want to know how these categories in depth are graded, we have it laid out there. There's a blog that'll give you a nice overview, and you can also purchase a printed copy online.
Yeah, and the State of the State scoring rubric is particularly important. I definitely recommend everybody go to safeaccessnow.org/rubric, or you can find it on the page that Andrew was just showing you. That will give you a comprehensive overview of all 120 metrics that we graded each state and territory on. It gives you information on why it is important and what kind of metrics we use to assign points and why. So that website, or that link in particular, will give you even greater insight into the report. So now diving into the report, as Andrew just showed you, again, you can find it at safeaccessnow.org/SOS. This year's report is very exciting. There are a lot of changes in this report, which we'll get to in just a second. First, I do want to thank our sponsors for this State of the States webinar. Without their support, this report and the webinar would not be possible. So we thank them for everything they've done to help us get to this point. Okay, so now getting into what is new in this report. First, I want everyone to know that we reworked the grading scale. So on previous reports on the years before, it was more on an academic scale where 65% and lower received a failing grade. This year, we changed that to more accurately reflect the different kinds of laws that are in the states, and because we also updated our grading rubric. This grading rubric puts a lot more emphasis on the actual patient experience in those states. So instead of looking at whether there's a law on the books or whether they simply allow retail access, we take a deeper dive to see what this looks like from the patient's perspective. If somebody is trying to get a certification for their registration, if they're trying to register or even afford products, what does it actually look like for a patient on the ground? And this is where we think the grading should be focused, because it's not enough to have a law on the books, but people need to actually be able to access the medication. They need to have the legal protections that come along with that. Also highlighting this year, we have 3 new sections. The first one is health and social equity. We also added an affordability section. This section looks at not necessarily the price of products in the state, but all of the other financial burdens that come along with being a cannabis patient, including things like registration fees. And then this year, we also added a penalties category. There are certain things that states do that actively harm patients. And we thought it wasn't enough that they just simply not receive points for things. They needed to be penalized and have their scores deducted for doing these especially harmful things. And we'll get into some of those in a little bit so you can get a better idea of what we're talking about. Here's an overview of all of the grades throughout the United States. There are 48 states and 5 territories that allow some kind of form of access to cannabis. In some of those states, it's CBD only, and in other states, it's adult use and medical. 18 adult use states, 22 states have a medical cannabis program, and 13 have CBD only programs. 2 states, Idaho and Nebraska, are our lowest scoring states this year. Both of them received a 0% because they still have a total prohibition on cannabis. And also, remember, I mentioned earlier that we have a new grading scale this year. You can see that on this slide. So instead of having an academic scale where anything below a 65% was automatically failing, we adjusted it sort of like a curve to have the letter grades better correspond to the natural categories that we were seeing within the grades. For instance, in the F category, the majority of states you'll see there have CBD only laws, or in the case of Idaho and Nebraska, have a total prohibition. So to us, it didn't seem right that something like a state like Idaho and Nebraska would receive the same grade as, maybe New Mexico that does have a medical cannabis program. So that's why the grading scale was changed a little bit this year. Can we go to the next slide? Here we go with some top line data. This year, the top score was a 76.14%. That's a B on our grading scale. Congrats to Maine, our highest scoring state this year. That was them. The average score across all the states and territories was only 44.38%, which is a D on our grading scale. So as you can see here, this really just demonstrates that just because states have medical cannabis laws on the books does not mean that their job is done. The United States as a whole, all across the country, still has a lot of work to do to be providing the safe, legal, and affordable access to medical cannabis that cannabis patients deserve. You'll also notice on our distribution chart, there was no state that received an A. Maine was our highest state, and they received a B. A majority of the states, 21, fall into the C category. They're average programs that need a lot of improvements. And then we had 13 states that just failed altogether. So again, the average score highlights this, but so does the distribution chart, that we have a long way to go and our work is not done. And so we look forward to passing some of these additional protections for patients. And then again, at safeaccessnow.org/rubric, you can find a comprehensive list of all 120 metrics that we graded states on, why we graded them a certain way, and why it is important. So please check that out. I cannot overstate enough that that is an important resource for really understanding why states got the grades that they got. So now we will dive into each category just to give you guys an idea and an overview. In civil rights and patient protections, Delaware, Illinois, Maine, Minnesota, South Dakota, and the US Virgin Islands are what we refer to as our gold standard states for this category. Gold standard states don't mean that those states are perfect. It means that they were the highest scoring in that category this year. So as you can see here, our gold standard states, they got a 90%, but there are still things that they can do to improve. In the case of all of these states, the majority of them were completely missing parental rights protections. In most states, the fact that you are a medical cannabis patient and that you use medical cannabis can be used against you in family court and child custody determinations. So one thing that all of these states can improve on is making sure that those protections are in place and parents who are medical cannabis patients are not discriminated against because of their patient status. The average score in this category was only a 57.47, which is very sad to see because at minimum, patients deserve the world and all the help that we can give them. But at minimum, the state has a responsibility to legally protect patients for their medical decisions. And the fact that across the United States, the states only scored 57.47 is really disheartening. And I hope a lot of states take something, if they take something away from this report, I think it's that they need to do better for patients in civil rights as well as affordability, which we'll get to in a second. The next category, access to medicine. Maine, 95% in this category. Again, another low average across the country, only 39.47. Most states do authorize retail access. A lot of states, however, do not allow personal cultivation, which is very important for patients to make sure that they have a steady supply of their treatment option and one in which they can control if they have the means or if they would like to grow. I know some patients wouldn't want to, but patients should have that option. And another big one here is reciprocity. A lot of states, even if they have a medical cannabis program, do not automatically allow medical cannabis patients from other states to access the program, which is really detrimental to patients. I know that I don't have to tell anyone who's a patient of any kind that just because you cross state lines doesn't mean you don't need your medication anymore. The same is absolutely true for cannabis patients, and reciprocity really makes it hard for patients to travel, to do their work, to visit family, because they have to worry about looking up, navigating, understanding laws in a lot of different states and whether they will even be able to access their medication in that state. So one easy thing, quick thing, very important thing for states to do is open up reciprocity. And by this, we mean full reciprocity, as in a patient can show up to a retailer with their out-of-state patient card and immediately get access to cannabis without any additional registration fees to the visiting state or any additional hoops they have to jump through. They should just be able to show up and access their medication because they're a patient in another state. Here we looked at program functionality. A lot of this is what happens on the back end. Some of it may not be things that patients are super familiar with, but things that do impact patients. Maine was our gold standard state in this category. This is the only category where our gold standard state received a 100%. Thankfully, this category is also one of our highest overall average scores with 60.84. So this tells us that programs aren't completely broken, which is good news, although we are here to improve them, certainly. Some things to look for in this section are representation and decision-making. Some states have committees made up of a lot of different people around the state to make decisions on the medical cannabis program and any changes that happen to the program. It's very important that there are physician and patient representation on this decision-making body. It's important that the people who actually use and navigate the system have a say in the system. Another thing to look for here are reasonable possession and purchase limits. A lot of states have an overall monthly cap on the amount that you can purchase per month, but they also have either a transactional or a daily maximum that you can buy. So in some states, you can get up to 5 ounces a month, but you can only buy 1 ounce at a time. It's really important that states make their purchase limits, the amount that somebody can purchase at one time, equivalent to the monthly allotment for cannabis that a patient is allowed in the state. Just like any medication that you would pick up from a pharmacy, you're not expected to go to the pharmacy once a week to pick up 7 days worth of medication and then head back a week later. Generally, you get at least a month at a time. And so the same should be true for cannabis patients, that you should be able to make one trip to pick up your medication for the whole month. We can go to the next slide. Here is a new category, affordability. And earlier when I mentioned that our gold standard states are not perfect states, this is really what I was thinking of. Illinois is our gold standard state for affordability, and they only received a 65% in this category. This category was also the lowest overall average at only 39.69% across the country. We hear every single day from patients that affordability is one of the biggest issues that they face with a medical cannabis program. And it comes in a lot of different forms, not only purchasing the medication itself, the cost of products in the dispensary, but also all the other costs that come along with being a patient. For instance, most people, cannabis is not the only treatment that they use. It may be the only treatment that they have to 100% pay for out of pocket because they do not allow insurance coverage. But patients typically have a lot of medical costs per month. And so medical cannabis is just added on top of that, and something that a patient has to shoulder themselves. We also look at what kind of registration fees or administrative fees go along with being a patient in the state. The registration fees should not be burdensome. Ideally, states should not require patients to pay for the ability to access cannabis in the first place. Because a lot of states do require a registration fee, in this category, we awarded full points if it was $50 or less, but some states do have registration fees that are up to $200, $300 every year that a patient has to pay just to be able to access their medication, which is unacceptable. Patients should not be shouldering the burden of paying the administration fees of a medical cannabis program. And we can go on to the next one. And I will hand it over to Andrew so you can hear from someone other than me for a second.
Oh, thanks, Abby. So health and social equity is our second new section. We wanted to include this section because for patients, the use of cannabis should be a medical right, regardless of age, criminal background, income, where you are in a city or a town, and out in the rural countryside. So states need to prioritize policies that fix these inequalities to access, including protections for renters. There's about a dozen states that would drug test you for welfare benefits, and they would not extend an exemption to this testing for cannabis patients. So a lot of points are lost there. This is where we grade whether or not minors have access in the state. There's a lot of states where, although minors have access, it's more severely limited in that they might have to go through 2 different doctors' recommendations, where adult patients would only have to go through 1. They might have the products available to them limited. They might have the conditions allowed to treat cannabis to them limited. So access for minors is not always equal to the access allotted to adults. There's also graded here is whether or not organ transplants are protected. A lot of people don't know that they can register as a medical cannabis patient and start treating their condition. And if they wind up needing an organ transplant, they might get to the hospital and they go, sorry, it's too risky. Cannabis might up your blood pressure. So there are a good amount of states that do have language protecting patients from that, but a surprising amount still do not. We also look at, as states license cannabis businesses, whether they are licensing them to the people most impacted by the war on drugs. And we also look at if those businesses are being distributed in underserved areas, whether that be neighborhoods most impacted by the war on drugs or also rural neighborhoods. We don't want 100 dispensaries in your state and they're all located in the nice retail areas where the rich people can shop. All right, moving on. So consumer protection and product safety is our most comprehensive and meticulous section. It has been entirely reworked. You may remember it from previous reports, but it's been entirely reworked to better reflect our PFC standards. The overall value of the category has also been doubled. So this category versus all the others is worth twice as much. It's worth 200 versus 100 points. It's a very comprehensive category. You can see these 4 cultivation, manufacturing, dispensary, and laboratory operations. Well, we don't show you everything that's under the hood right here because I could never fit it in one slide. It's just not happening. And it's, like I said, it's the most meticulous category. Let's see, we break down standard operating procedures, required testing, quality management, staff training, and a lot more is all kind of under the hood here. It's also a category with a very low average score. It's almost the lowest if affordability didn't beat it out. But when you look at an average score across the country this low for something that is grading how safe your products are, you might be a little scared. And yeah, I mean, it really shows that although there are states like Nevada that are performing well, most of the states, even ones that have been around for a long time, even ones that score very well, like our top scoring state, Maine, like have not gotten their consumer protection and product safety standards to where they need to be for patients.
And on this category, it's also something that patients typically don't see, that it's not right in front of their face, the kind of training or requirements that are on cultivation operations or manufacturers. Mostly all patients know is, what they pick up from the dispensary and the label that's on it, and just trust that the state has made sure that it's safe. And so what we're doing with this category is looking from seed to sale, from, when it first starts as the seed to where you pick it up at the retailer, making sure that all of the right safety components and trainings are in place so you can know that the medication that you pick up from a retailer is safe. It's not just enough to have access to any kind of cannabis, you need to have access to safe cannabis as well.
Yeah, because a lot can happen in between the time it's planted as a seed and the time you're consuming it. So there needs to be reliable, recreatable procedures across the entire supply chain, so you can rely on your medicine. Our final new section is the penalties section. You might recognize some of these elements from older reports, because as we were looking at this new scorecard and thinking, okay, what do we want to put on here? What are we prioritizing? I was noticing a lot of lines where we'd given states points for not doing something. State does not require vertical integration, 10 points, congratulations. We took a lot of those and we said, okay, you do these things that are unnecessary, arbitrary, and just make things worse for patients. We're not going to give you points for not doing them anymore. We're going to penalize you for doing them. And so most of these are, come from that. But we also brainstormed a few others that really will hurt patients. And that when we see them, we just, shake our heads and wonder, why are you prioritizing, your adult use program over your medical program? Why are you forcing patients to try every kind of opioid, every kind of pill, whatever under the sun before letting them get their cannabis? Why are you limiting the THC content in your product? Some states have very arbitrary THC content. I think, wasn't it, Abby, Mississippi's new bill where THC is like limited to like 30% in flower, but like 60% in concentrates. So it's like absurdly high for flower, but then like insanely low for concentrates. So they were just like, they had no idea what they were doing. They were just picking numbers randomly. So yeah, it's stuff like that we look at and we think, okay, it's not enough that you're just not getting points. I think we should actually take some away from you because you're goofing us at this point. Okay, so now we're going to move on to actually look at a few of these states in comparison. We're going to look at our top scorer, Maine, versus a state that did quite well last year, but has actually fallen significantly since then in this new grading scale, which is Oregon.
Yeah, and one interesting thing to note about these states also, so the State of the States report, we only grade the medical cannabis program, but both Maine and Oregon also allow recreational adult use cannabis. So it is kind of interesting to zoom in on just the medical cannabis program and see how these two states compare to each other.
Yeah, you can really see the difference between a state that has adult use and decided to keep giving attention and care to the medical program and the patients there, which is Maine, and a state like Oregon, which, rolled it into the Liquor Commission and sort of said, forget about it. Oregon was one of only 4 states with a declining patient population. And you can kind of see why. Let's first compare the score here in a category where they both did relatively well. So this is access to medicine. You can see that in sufficient number of licensed retailers here, both scored 30 out of 30. You'll know if you're experienced with shopping in Maine or in Oregon as a patient, these dispensaries are everywhere. It's not hard to find a point of access in either of these places, but where Oregon falls short is no ability for collective gardening. And that is what has actually given patients in Maine such comprehensive access, is this caregiver system where anyone registered as a caregiver can start a cultivation as long as they're in a town that allows it. There are some municipal rules. And they can sort of add other caregivers or patients and grow the size of their cultivation based on how many people they have collaborating with them. And it's been a system that has been able to sell products into the medical system where caregivers can also be retailers, and it's provided a lot of access to Mainers. For a small state, there is a lot of retailers.
And another one for this category also is Reciprocity. While Maine did not receive full points for reciprocity, they did receive the majority of points, and they do allow a lot of patients access. But one important thing to note here is that Oregon does not offer any kind of reciprocity for any medical cannabis patient in other states. You'll see that they got a 5 out of 20 here. This is because medical cannabis patients in Oregon can still technically purchase cannabis because they can go into an adult use retailer if they are 21 or over, but that's not patient access. So they got 5 points because some patients may be able to buy something, but really they don't allow it at all in the medical dispensaries. And this also means that visiting patients don't receive any kind of discount or sales tax break because of their medical status, which means it costs visiting patients more.
Yeah, and the reason Maine didn't get full points in this category is because they have one little rule in their laws that says that your state ID and your medical cannabis ID have to be from the same address, same jurisdiction. And that might be a problem for someone who hasn't necessarily updated their driver's license, hasn't updated their medical card. Like we're saying, updating a medical card in a lot of places, that might be the difference between you just not being able to get medicine at all because it's $200, $50 you don't have. So it is something that might stop patients from being able to get reciprocity access. But as long as you have matching cards, visiting patients are welcome in Maine. And let's move on now. So this is our patient rights and civil protection section where Maine did quite well and Oregon actually performed poorly. So in Maine, we can see that pretty much everything is covered except for this DUI protections category here. This is something that a lot of states don't have any sort of protections for. Oregon also doesn't see it, as you see. I mean, this is a problem for a lot of patients because cannabis stays in your system for quite a while, and law enforcement still treats any trace amount of cannabis like it's a trace amount of alcohol. There's no scientific basis for how they measure this stuff, and so it has been a problem for a lot of patients. And very few states have recognized that you can't really write DUI laws like you can for alcohol. Because you could be taking a tincture that doesn't get you high, just helps you with sleep, but there's cannabis in your system. And the next day you're driving, you're pulled over, you're tested, boom, cannabis in your system that tell you you're impaired. You weren't, but it's in your system, so you were by their standards.
And I think this is an interesting category to compare these two. You can see the difference in Maine, which has a very thoughtful program. What kinds of protections do patients need, and really thinks about the kind of things that impact patient lives, like employment, parental rights protections, and the privacy standards of patients. Whereas in Oregon, it's pretty short-sighted because essentially they're saying like, okay, you can't get arrested, as if that's the only problem that a medical cannabis patient would come up against. So, this is what we're talking about when we talk about the difference between states that are really thoughtful in their medical cannabis laws from the patient perspective and states that are pretty short-sighted, like Oregon, in regards to patient rights and civil protections. Then we can go ahead and head to the next one.
Yeah, so if affordability is one where neither of these two states did well. And we mentioned that this is the lowest scoring category overall. You'll see, even the best scoring state didn't perform well here. Why? It's mostly right here, this health insurance. No state scored points in this category.
Oh, Andrew, your audio, I don't know if it's just for me, the audio went a little weird.
Okay, do you want to just take over?
Sure, yeah. So in this one, as Andrew was saying, No state received points in covered by state insurance or health aid. This was something that we knew going into it, that likely no states would be able to receive points in this category, but it's one that is so critical and important to patients. As I mentioned earlier, medical cannabis is a health expense that is completely out of pocket for all patients, no matter what kind of insurance you have. So it can get very expensive and it can get cost prohibitive for some patients. So while no state receives points in this category, we kept the category, and the category will be there in future years because states do need to figure out a way to help patients in this way. And then another thing that we'll just quickly mention in this category as well are the reasonable registration fees. Oregon has one of the highest registration fees in this country. I believe it was $200 a year. Yeah, and then Maine, let's see, Andrew, is your mic maybe working? You want to talk about Maine's?
Yeah, you hear me?
Oh,
Maine.
it's a little weird. I don't know if it's just me here.
Uh,
But Maine does not have a registration fee. Is that correct? No, I'm looking at, oh, okay, yeah. I thought it was, but then you made a face, Andrew. So Maine does not have a registration fee. And this is something that should be consistent across all medical cannabis programs. I've mentioned a couple times that, the financial burden of running a medical cannabis program should not fall on the shoulders of patients. And Maine has taken a step toward that to alleviate that burden of registration fees. The fact that Oregon has recreational adult use cannabis that is taxed heavily and brings in a big revenue for the state, and but when you take that fact and add in the fact that they have a $200 yearly registration fee for patients, it's offensive. I don't know a better word to use for it. There's no reason to be charging patients $200 a year, especially when you are raking in millions and billions of dollars from adult use sales. You need to alleviate some of this financial burden from patients. So that's what I will say on the affordability point for Oregon. And this is something that they should fix immediately. Then we can go on to the next one.
Can you hear me now? Is my mic working?
No, it's still weird. I don't know. I will just take over from here. Sorry to take your spotlight, Andrew. Quickly, we will go over some of the key takeaways that we learned from the report. The first is that growth is a general trend. The majority of states with medical cannabis programs did see higher enrollment numbers in the past couple of years, and the programs keep growing and they keep adding patients. This is good news. People are getting access to medical cannabis, and it shows that programs are working and getting people access. There were some states that had lower enrollment numbers, but 4 states that had lower enrollment numbers, but all of the rest either saw tremendous growth or really kept level. Then we can go on to the next one. Small improvements really can make a big difference for patients. At the beginning of the COVID-19 pandemic, when all of the lockdowns began, Americans for Safe Access was hard at work ensuring that governors in all of the states with medical cannabis programs classified medical cannabis dispensaries as essential businesses, which allowed them to stay open and continue serving patients through lockdowns. In addition to this, states went ahead and took a couple safety measures for COVID-19, including allowing telehealth for physician certification and recertification, as well as allowing things like curbside pickup at dispensaries and delivery of medical cannabis products. What we've seen, since then is a lot of states have seen what a big impact this means for what a big impact it has on patients and for their access. So the fact that they could have products brought to their home instead of worrying about getting to a dispensary, finding someone to drive them there. Patients may have mobility or pain issues that make it hard to travel. Even just being able to have somebody come out to their car that's in the parking lot outside of the retailer really went a long way to helping patients and the patient experience within the medical cannabis program. So what we've seen since then is states have recognized this, and some states have, through legislation, made these permanent. 8 states have. Other states, the majority of states, have extended these provisions. So they're still in effect now. They're not permanent yet, but they're still in effect, and we are hoping that they will become permanent. But what we saw here is a change that a state can make quickly and in response to health needs. In that case, the COVID-19 pandemic really can make a difference for patients. And so they need to continue doing things like that. We've talked about it this whole webinar so far. The cost of medicine remains a major burden for patients. States really need to focus on affordability, not only on the cost of products, but all the other costs associated with being a medical cannabis patient as well. We can go to the next one. No state is perfect. Maine is our highest scoring state this year, and they received a B. So there's room for improvement in all 50 states and 5 territories. So just because a state has passed a medical cannabis law, that does not mean that the policymakers in the state are free to focus on anything else now. They need to still be focused on medical cannabis. This also doesn't mean that they can't be working on other things. And it also doesn't mean that a state can't introduce recreational adult use cannabis laws as well. The important thing is that a medical cannabis program exists and needs to continue to exist. And lawmakers really need to improve them to serve the patients in the state. And then the last key takeaway is these programs cannot reach their full potential without a change in federal law. The Schedule I status at the federal level and the still total prohibition on cannabis, as well as the federal government's willingness to just sort of pretend like medical cannabis doesn't exist, really burdens patients, and it can be harmful for patients in a lot of ways. For instance, even if a state has housing protections for medical cannabis patients, if there are any patients in the state that live in federal housing that they receive through HUD, then they don't receive the same housing protections in the state because those fall on the federal level. So the the federal government really needs to get its act together so states can help patients. And so all patients within the state can be treated the same. And then I think one last note before we turn it over to question and answer. Recreational adult use laws are no replacement for a medical program. Both can coexist in a state. Like we see in Maine, they have a medical program and they have a robust recreational adult use program, but they keep the 2 programs and the benefits of the 2 programs separate. There are benefits in a medical program that only a medical program provide, like patient rights, sometimes employment rights, housing rights, definitely. That your status as a patient matters. It's not just about the behavior, but your status as a patient protects you. So states need to recognize this and maintain their medical program even as they start passing recreational adult use laws. If you see, sorry, can we go back? If you see any lower enrollment numbers in states that have recreational adult use laws, I want to caution people not to read into those as aha, I knew medical cannabis was just a front for recreational use. And now that we have recreational use, all these people who were patients before are no longer patients. That's the wrong way to look at it. I think you need to take context into consideration here, and the fact that there are so many financial barriers to being a patient. There are so many hoops to jump through, so much paperwork, that sometimes patients see it as an easier option because states have not improved their medical cannabis program to make it easier. They think it's just an easier option to go to recreational, but that does not mean that they are not real patients, and that there are not real patients currently benefiting from the medical cannabis program. So it's important, if states and policymakers only take one thing away from this report, it should be that the medical cannabis program provides rights and protections that only a medical cannabis program can. And even in the face of passing recreational adult use, that is no reason to do away with the medical program or combine the two. All right, and with that, I want to thank our sponsors again for all of their support on this report. And then we can show you the next slide. Everyone can have a view of the states and their grades again. And we can go ahead and start with some Q&A. So if you have any questions, feel free to type them in the chat, and we will answer them. I know that we received a couple questions throughout. So the first one, since the highest score was a B, is there any place we can look to that's worthy of an A outside of the US, perhaps? I would say the best place to look for what would be an A grade is to look at our rubric. Look at what we grade each state on. The rubric itself would be what we consider an ideal state. It's not necessarily a state that includes every single protection and provision that you can think of, but it's one that provides the most important protections and patient rights and affordability for patients. So I'm not sure if there is a place outside of the United States that would receive an A based on our rubric, but I think the rubric should be the overall gold standard for what a perfect state would look like, one that provides everything that we grade it on. Next question, does parental rights cover just parents that are medical cannabis users, or does it address parents that are giving medical cannabis to minor children? For this one, we did just grade whether a parent who is a patient has protections in custody determinations. It is a little harder to figure out the issue about parents administering medication to children and whether that could be used against them, because it's not often written into legislation or into the law. A lot of times it's case law. There are pending cases across the country. And so there is unfortunately no good answer for that right now, and no good way to grade all of the territories on that. Although those protections for parents who are administering medical cannabis to minors, those are protections that Americans for Safe Access believe need to be in place. It's just unfortunately hard to put a metric on it right now. And you'll find that in a couple of different areas, that because cannabis law is such a gray area with courts around the country litigating it, and also there's the state and federal argument over cannabis law and whether it should be prohibited. There is unfortunately a lot of gray area that we sort of have to wait and see how it plays out, while also advocating for what we want. Another question is, do we have any veterans and Medicare or Medicaid categories, and any veteran categories in the state? Veterans are one of our top priorities overall. This is another one that's hard to grade for states because a lot of policies that impact veterans come down from the federal level. And so there are things that states can do, but for the most part, their hands are tied, especially through Veterans Affairs and VA hospitals. We did look at one of the grading metrics is whether there are any discounts or waivers available to individuals in the state. So for that, we did look to see whether there were any veterans discounts available or anything of that nature. But because policy about veterans and their access to medical cannabis is largely at the federal level, it is not really something that we could fairly grade the states on, just understanding that their hands are tied because of federal inaction. Although on that point, I would like to point out that, sorry, I lost my train of thought. I would like to point out that we do work on this on the federal level and that it's one of our top priorities on the federal level as well, making sure that veterans have access. And again, through Medicare and Medicaid, a lot of that has to go through approval with the Department of HHS. So that is more of a federal priority for us than a state priority. Another question, is Ryan's Law being implemented in California? Yes, no, and maybe, which is not a great answer. The law has gone into effect. Americans for Safe Access. We also have an implementation guide for Ryan's Law. If our moderators would be so kind as to put that link in the chat for everybody, that would be great. So there are a lot of institutions that are trying to figure out how to implement the law. Some of them are taking their sweet time trying to implement it. They haven't said no yet, like other places have said no. So it's a long answer. Some places have used our implementation guide and it is in place. We're working with other places to help them implement it and to educate them about the fact that they do not have a choice but to comply with the law. And then we are also working with the institutions that resist the law, again, to let them know that that's not their place and that there are resources for implementation. And hopefully that link was added to the chat for you guys. Let's see, Andrew, do you recall the 4 states with lower enrollment numbers? I don't have that right in front of me.
Yeah, can you hear me now?
Yes, it's much better.
Okay, they were Alaska, Massachusetts, Michigan, and Oregon.
Yeah, so
all states with adult use.
Yeah, it could be for a lot of reasons. We didn't really dive into the why. One reason could be adult use. And as I mentioned earlier, that there are such high financial burdens associated with being a patient versus just being an adult in a state. Like in Oregon, patients save $200 a year right off the bat if they just don't register as a patient. That doesn't mean that they aren't a patient. It just means that they are someone who is looking to save $200, which is.
And as we saw, like in the patient rights and civil protections comparison in Oregon, if you're a patient, you don't really have any benefits of protections versus not being a patient. Like the only thing you're getting is not paying taxes at the register. You're shopping at the same place. I mean, it's $200 a year probably doesn't feel worth it for a lot of people.
Yeah, and I think in something those 4 states have in common, also, or at least most of them have in common, is sort of a blending of the two programs, not understanding that they should be separate. I don't mean patients not understanding that they should be separate. I mean policymakers not understanding. So it does make it harder for patients. The next question here, do any states allow medical cannabis for institutionalized patients, patients in state prisons or state psychiatric hospitals? This is not something that we grade. It is perhaps
I also
something,
didn't see it anywhere.
Yeah,
Yeah, I saw a
right.
few places where it's specifically prohibited, but I didn't see anywhere where there would be an allowance for it.
Right. To my knowledge, no. Specifically for prisons, it is going to depend on, what kind of prison it is, if they can even consider it. My gut tells me that most of them will say no. Federal prisons will definitely say no, but it's definitely not common for people who are institutionalized to have access to cannabis. But even a step further than that, not even people who are institutionalized, but individuals with disabilities or who need extra health care who are in group homes or nursing homes, they also often do not have access to medical cannabis as well. And that is something that we're working on. Can we expand on the kind of federal legislation ASA would like to see? And also, do the states need to work toward all of these goals if certain legislation is passed? So first, for the kind of legislation that we would like to see at ASA is some kind of legislation that creates a national coordinating entity for cannabis, like an Office of Medical Cannabis Control, an Office of Cannabis Control, a central government agency that will be an expert on cannabis. This wouldn't be from our view, it's not the federal government controlling medical cannabis. We want this agency to set a floor, minimum standards that each state needs to follow to protect patients. And so all the patients, or sorry, all the states that are below that will be required to add more protections. And then obviously states will be free to add even more than that. And separate from that, a national coordinating entity will help provide some kind of standardization across the country. And it will also take the piecemeal approach that the federal government has right now. DEA is responsible for a little bit of cannabis policy. FDA is responsible for a little bit of cannabis policy. HHS, DOJ, there are tons of agencies that have just a little piece of the cannabis pie. And so all of those responsibilities from the other agencies would then fall under this Office of Medical Cannabis Control or Office of Cannabis Control. And so there is a government one-stop shop for all things cannabis, and that will go a long way in coordinating things for patients. As for whether there's any federal legislation that would help states reach their goals, the federal government needs to recognize that veterans need access, want access, deserve access to medical cannabis, and also loosen up some of the rules around schools for minors who are medical cannabis patients. If the states can do those two actions, that opens up a lot of possibilities for the states. Also, if the federal government reclassifies cannabis and stops the total prohibition and war on drugs on cannabis, that helps states a lot too. Although I do want to note a lot of this is under state control. So the federal government, they can change policies that will then allow the states to do things that they're not allowed to change right now. So the states would still need to take action in a lot of these instances.
Right, like a state that there are plenty of states that have housing protections, but then it'll say, well, I mean, unless it wouldn't change, the federal government changing that rule wouldn't change a state that says that you can be kicked out already, but it would change a state that has the rules that protect patients, but doesn't go so far as to protect you in federal housing because they can't yet.
Right. Yeah, that was a good example. All right, and then we are running up against the top of the hour, so we're going to do one last question, which is, will we be able to have access to this presentation link to pass on to legislators in our state? And if yes, how soon? Yes, the good news is you will be able to find this presentation. I believe it will be both on our website and on YouTube. Somebody please correct me in the chat if I am wrong about that. You'll also be able to send the report to your legislators. Please make sure that you are signed up for our mailing list. Go to safeaccessnow.org to sign up for that, and we will send you an action alert in a couple days that easily links you to your legislators, and you can easily forward this report to the legislators to make sure that they've seen it. So make sure that you are signed up for that. You'll not only get the action alert coming in a couple days, but you'll get our monthly newsletter to stay up to date with everything going on with medical cannabis, and you will receive other action alerts for things that are going on in your state or on the federal level that we believe your legislators should hear from patients. I also want to mention that everyone can go to safeaccessnow.org/membership to sign up to become an ASA member. It is only $35 per year. There are a lot of perks and benefits to it. And being an ASA member really shows your support, and it helps us continue our work. Without your support and without ASA members, we would not be able to put together the State of the States report. So please, I encourage you, if you like this report, if you like the work that ASA does, please go to safeaccessnow.org/membership and sign up to become a member today. And then two last links I'm going to throw at you just to remind you. You can find the full report at safeaccessnow.org/SOS. And you can also find our full rubric to see a comprehensive resource about how and why we graded each state at safeaccessnow.com/rubric. Thank you, Andrew, so much for going over this with me. I know it has been a labor of love for both of us over the past couple of months. We would not have put so much work into it if Andrew and I were not so passionate about medical cannabis and cannabis patients and making sure that they are protected. So I really hope it is a resource that everyone finds useful. And I hope this webinar was useful as well.